we've got a panel of prescribers and therapists and just practicing like from different perspectives and angles within the ketamine therapy space. And I think we'll start by maybe just asking each of you to, rather than me like reading your bios, if you don't mind just introducing yourself and maybe just a little bit of your own trajectory briefly into like how did you arrive into ketamine work? I don't imagine you probably started in ketamine therapy in your practice, but you arrived there. So maybe just a little introduction about who you are and just how you arrived to be working with ketamine as a tool in your mental health practice. Is that okay? Yeah. Who would like to? Herman. Would you please? Thank you. And welcome.
My God. First, well, first, thank you so much for having us here. So, gratitude to you, Nowak. Thank you all for coming. I know some of you. That's encouraging. So, I'm Herman Ascani. I'm a psychiatrist. I practice in Fort Collins at the Wholeness Center, which is a collaborative clinic, small group practice, approaching mental health from different viewpoints. There's naturopathic doctors, psychiatrists, NPs, therapists, and so we have our different approaches and we collaborate in that. I new to Colorado, so I'm from California. Anybody from California? Okay, so Sonoma County, a little bit north of San Francisco, and 10 months in Colorado, and so far having a good time. I started working with ketamine there in 2017 and continue that work here. So, and I still do through the clinic there, Evolve Mind Wellness, which was strictly capped as I envision it with greater goals in the future of like holding psychedelic community, psychedelic space, and psychedelic assisted therapy as they would become available through the regulatory process. But my trajectory into that was out of community mental health, out of Harbor UCLA in Torrance, community, hospital, acute, acuity is really high. Psych emergency was it. That was our training, our pride and joy. So a lot of altered, non-ordinary states of consciousness there in training. But as I went through community mental health and bought into the biological model, I became not to like it, enjoy it. I was very restricted in my practice, and I was not relational in ways that I wanted to be in connecting with people. And so enter ketamine and this marriage between medicine and therapy, and in a very powerful way. And I just had the luck to meet Phil Wilson in a gathering. Gary Bravo was a mentor at Sonoma County, who's also in the ketamine community. And so I met Phil and started in his practice, training with him. I have my own ketamine experiences, which I'd love to share with you. And then I just like fully embrace a new path in my trajectory, and now I do a lot of ketamine work, therapy, and also other treatments. And we'll get into the details of that. And I'm not turning back. So that's me.
Hi, my name is Shoshana, and I am the owner of Watermark Counseling, where I am the sole practitioner, so that's me. I do work with teens. I see a lot of people through a consultation, and I'm a supervisor, but at the moment I'm keeping it very small because that way it's more malleable and able to make quick decisions, and I find that in this work that's what's needed to get away from the corporate model and be able to move more towards inclusivity, and that's really my goal in this work. So I've been doing that kind of work for a very long time, trying to figure out how to make mental health inclusive, and that's actually how I got here. I have a doctorate in clinical psychology from DU, and while I was working there and getting my degree, I focused on multiculturalism, which was a word that I'm not even sure I like anymore, but you know, that's what we had. And I ended up working at places like Asian Pacific Development Center and Our Native Healing Center. And in that work, I was working with clients that were seeing me and seeing this shaman on the side, or journeyman sometimes. I had no understanding of this before that. I grew up in Colorado and was brought up by someone who felt like all drugs are bad. I was supposed to tell everyone I saw doing drugs that you were wrong, please stop. This was about the age of 8. I was supposed to be doing this. But when I saw what these people were doing for my clients and we were doing this work together, it just felt like they had a piece of the puzzle that I wanted to be able to use with every client. And after that, I actually started to find the Nowak meetings, and I started to learn about what MAPS was doing. It looked beautiful, but it's very hard to figure out how to provide MDMA and psilocybin when you also want to be running a business that's above board. So I ended up talking a lot at these meetings to different people and stumbling upon ketamine, which was wonderful. I've been providing ketamine therapy for 2 years now, and I find that it's just, it's really filling in that gap that I've been seeing missing. So I'm very appreciative of it, and of all of you for coming today.
Sorry. I was going to say there might be a couple of chairs over here and maybe a spot on this booth here if folks are looking for something. Thank you. Please go ahead.
Hi everybody, thanks for coming tonight and thanks for having us and thanks for being the Nowak Society. My name is Sara Markey. I'm a psychiatrist. I've been practicing for 30 years. I can't believe it. But about 10 years ago, well, my first love in psychiatry was really community mental health centers and community mental health and people who live with severe persistent mental illnesses and their families and the communities around them. And I really enjoyed like teamwork at the mental health center. Really enjoyed that a lot and worked for a long time with a variety of adults and adolescents with varying psychiatric conditions. I had a private practice here. Like at one point I had 5 jobs. You know, I was working at a place for women who were coming out of prison. I was working at it was fun, primary care consulting. Anyway, then I was in private practice and I started reading about ketamine about 10 years ago. And I started talking to other psychiatrists and therapists about it, and they would just tell me I was crazy and that I should stop talking about it. I mean, it was really, I got a lot of pushback. They said, this is a psychotomimetic agent. You cannot give this to patients. You will stop right now. Stop doing drugs. Okay, so, I don't know, like I tried little intranasal, intramuscular stuff in my office, and one day a patient walked in who'd been getting ketamine treatment in another state. That's how helpful it was to her. She was not a woman of means per se, but she was flying out to New Jersey, renting a car, staying in a hotel, because this is the only thing that helped her. And she comes from a long line of depressed people, many of whom had committed suicide. You know, this has really been a transformative thing for her. Well, her prescriber in Denver refused to see her if she was going to engage in this subversive ketamine treatment. And so that's how I got my first ketamine patient. And then I started to I met her ketamine doctor and other ketamine people. And one day, in 2016, somehow I was able to work with some other doctors to open a ketamine clinic. And it was a good experience. And then they closed. Some investors took over, and I just like put an asterisk there. These investors, I learned a lot watching the company being dismantled, and the investors' goals were so different from our goals, and I was glad when they laid me off. I'm now running my own ketamine clinic, and every day we are learning more and more things. I'm so glad to be here because this is a growing field. I mean, what is high dose oral ketamine? Has anyone defined what that is, like for psychotherapy? Or we have a lot, you know, every ketamine article you read, it says more data is needed. So I just really enjoy this work. It's very exciting and multifaceted, and I work with some therapists, including Shoshana, who does some ketamine-assisted psychotherapy in our office sometimes with us, and yeah, I'm working on the MAPS Expanded Access Project, which is a theoretical thing at this point. It's been going on for years. So, I don't know. I'm just happy to be here. Thanks.
Hey everyone, I'm Bree. So good to see all of you that I know, and would love to meet anyone that I haven't. So I got involved in this work about 5 years ago, and I feel really lucky actually that I've had the opportunities that I have. I was not involved in psychedelic work at all, but just through synchronicity and connection, I connected with Scott Shannon up at Wholeness Center in Fort Collins. And I had just been finishing up my grad program out at Penn State. And all of my experience there, background, clinical training, I worked in the Children's Hospital working with kids and families with PTSD, and ended up getting connected with Scott up at Wholeness, and just reached out and said, I really want to work on a MAP study. And at that time, I just didn't even think it was possible. But long story short, ended up working as the study coordinator on the MAPS phase 2 trial, and then the phase 3 study. Phase 3? Is that right? Okay, thank you. And so worked as the study coordinator on that project for about 4 years. And a couple of years into that role, I just started sitting in with Scott on CAP sessions that he was doing, and they were slowly moving from they initially were offering IV infusions and slowly moving in towards the CAP model. So I would go in and just kind of sit with Scott as the MD who's prescriber, and then just had an opportunity to sit and hold space for people who were having infusion experiences. So that was how I started with my, kind of just dipping a toe in the water with CAP, and I just felt so lucky to be able to sit in the room with him and watch this process unfold. And in 2019, I decided to take a CAP training with Phil Wolfson. I did the training with Shoshana as well. So it's just really, things have really taken off in the last few years. And MDMA got breakthrough status in 2017, and when I started in that role, it was not a lot of people knew what we were doing or what this work was. And just watching it evolve over the last few years, seeing how many clients are often literally transformed with just a handful of sessions with integration and CAP with assisted therapy, but just to witness these really transformative experiences within a couple of hours, it's just and then simultaneously being on the edge of, I was doing all of the paperwork before and after the sessions as the study coordinator, and therapists would come out of their sessions. I'm oh my gosh, what happened? And I'd get to hear about it, but it was still I was a little removed. And so in 2019, I also was just lucky enough to be able to take the MAPS therapist training as well. And since then, just getting involved with more of this work, seeing more clients. So that's been my process, and I just, again, am so grateful, really, to the whole movement, but looking out at this room, right, how many of you are here? And when we first started these meetups, it's 5 people, and 3 of them were us. We practically had to pay people to come before. And it's in the last couple of years, and now looking out at this room being full is just, it's incredible, and it's such an honor to be involved in this work. It's such an honor to talk about this work. I try to tell people, I'll just talk about this all the time, so you're gonna have to just cut me off at some point. It's okay, stop talking now.
So you can email Bree at nowaksociety.org if you want to talk longer. Thank you, Shannon.
Thanks, everyone.
Thank you. introductions. It's quite a panel, and we're super honored and privileged to have every single one of you here tonight, so thank you. And so I want to get into some juicy questions, but first I feel like we should, just in case, yeah, I have some. But just in case, if folks might not be familiar with CAP, ketamine-assisted psychotherapy, like even what we're talking about, I just want to take a moment to establish a quick baseline reference point for folks. Would one or two of you just mind kind of describing ketamine-assisted therapy in terms of, like, there's different like routes of administration and different sort of like forms of like ketamine that you might use in practice. So would you just give like a quick overview of like what is ketamine-assisted psychotherapy and sort of what form of ketamine we're talking about, and what you might use in your practice for different reasons, for different purposes?
Also, Shannon, can you add in there first, what is ketamine?
And what is, maybe what is ketamine? Yeah.
I just got cut off, so. He's censored over here. So
Oh, I could say what ketamine is an anesthetic that was first synthesized, I think, in 1958. Correct me if I'm wrong. They were looking for an alternative to PCP because PCP had all these terrible, as you might know, emergence, psychosis, that sort of thing. And then in the Vietnam War, it was such a safe drug. A lot of soldiers would give it to their compatriots if they were injured on the battlefield before the medevac came and took them away. And so ketamine is a different animal. We have over 60 years of experience with ketamine as an anesthetic, but it's also used as an analgesic. I thought one of the most wonderful uses I've heard for ketamine as an analgesic would be in a burn ward where people were in agony. You could give them ketamine as an analgesic, but it would also kind of let them go to a different mental realm while they had to endure painful dressing changes, that sort of thing. Anyway, so it's an anesthetic, it's an analgesic. It's been very well studied. It's on the World Health Organization's list of essential medications because you can use it as an anesthetic. You wouldn't have to put a breathing tube in somebody. Third world countries don't have all the fancy stuff we do. You could just give them ketamine and take out their appendix. It's a very safe anesthetic. It's inexpensive, well studied, and at very low doses. It seems to have amazing benefits for many people with PTSD, treatment-resistant depression. I'll just stop right there.
And so what forms of ketamine, so if you're doing ketamine-assisted psychotherapy, maybe Shoshana or Bree, what does that kind of look like? Just very generally, briefly, we don't need to spend a lot of time with this, but like what does that form of administration look like? Low dose, high, like just a general sketch.
Yeah, so when it comes to using ketamine for a therapeutic purpose, it can be used in a variety of ways. People take it sublingually, intermuscularly with a shot, IV, where the IV is in them for an hour or so, or sometimes longer. And it's, at this point, basically, we just have lots of options and lots of people trying different things because while it's, a very old drug in some ways, it's very new to being used this way. So people are just trying to figure out what is, what do we have here? How can we try it? That means that we use it as a psychedelic with high doses between, the place where, it knocks you out and the place where you're experiencing those deep, soul exploring spaces. You can go way high and then you can go low to psychoanalytic or psycholytic, where you're just taking enough to kind of let your mind expand a little. And you're still in the room, you're still able to know a lot about your space. And specifically with CAP therapy, that's ketamine-assisted psychotherapy, you are looking to really integrate the therapy and the psychedelic work. So people are coming in most of the time for initial sessions. I ask people to come in for 3 or more because we want to have a good bond before we go in. Then you're also sitting with the person in the ketamine session, helping them with whatever they need in there, helping them set intention so that they know where they want to go in that space. And then afterwards, you go back to therapy for integration. So it's this whole way of like kind of holding the CAP experience in a lot of good therapy. Miss anything?
That's great. Yeah, thank you. Okay, good. So hopefully everybody are kind of on the same page, generally speaking, if you're not coming in already being familiar with ketamine and cap work. So maybe Herman, you might want to start us off with, I'm kind of curious, again, some people, you know, just the ketamine experience, I think it's really useful to kind of take it outside of like, I don't know, clinical, diagnostic sort of language and really talk about like the subjective quality of ketamine, especially as a tool like in the psychedelic toolkit. And so I'm kind of curious, one, about like that subjective experience, like what is the sort of psychedelic or psycholytic, like how do you describe that to like maybe new clients who are considering ketamine therapy, and maybe, you know, well, why don't we just start there? Because I'm going to have a follow-up to that too. But how would you describe just that subjective experience of ketamine space?
It's hard to describe because it's subjective. So I can tell you about my subjective experience, but in a little bit. But how I introduce it to somebody is just as a tool to engage in a process of exploration and deep, kind of like a deep psychological dive. And so it's not just a medicine, but it's how you engage with it. And you can engage with it at variable dosing for variable effects. And so then we get into that as we get closer to going into treatment. But first is like building the relationship and having the trust and creating that container, which is so important to this type of therapy. So ketamine embedded in a psychotherapeutic relationship, and so you're healing through relationship, and in groups you're healing through community. So the medicine is a tool to that process. And so I talk about that. I talk about the effects of ketamine to dispel like horse tranquilizer nightmares, and sort of like this idea of what ketamine is not. So I introduce ketamine like we did here. It's an anesthetic. It's been used in medicine for decades, safe. We're just starting to use it for mental health. We don't know all the details about it, but we know it works, and this is how it works, and here's the data. And so we can go through the data subjectively. So that's and then I call it the nerd science, because we can get into those details and talk about it forever. And people want that level, and so that's how I engage with them. And then there are others that really want process and engagement, and then you talk about the subjective psychedelic experience. So high dose, it leads to psychedelic. This is the differential and how variable it is. So, and that range, that it's a range because everyone's sensitive in different ways to the medicine. So you can have a low dose that's psychedelic, but the psychedelic in general is how we describe other psychedelics. I think it's through the phenomenology and the subjective. So it's not the mechanism of action, because ketamine is very, very different from LSD or psilocybin, and it's not through other ways of describing, like, what is a psychedelic? That's semantics. So phenomenology is getting to a state of disruption of your ordinary level of mind, of consciousness, into this other state in which you are freer, your mental processes are loosened, restrictive mind is sort of dimmed down, the volume switch goes down, and you are freeing different emotions, different intuitions, and then at times you can get to mystical level, sacredness, unity, things that you talk in psychedelic space, transpersonal experience beyond yourself. So sensing yourself in another way, and then opening doors to greater understanding, and then your suffering gets balanced by those other insights. So noetic phenomena. So that's how I describe it. And for me, because people want to know, have you taken ketamine? And I said, yes, I have. And it's great. And I can tell you that it totally changed my way of thinking and approaching my role in this world professionally, and then at another level personally. And that was, an amazing experience. And so then I describe it if they want to know. So.
Do you want to know?
But if I talk too much, stop me. So it's just like you can email me.
It's really fun to talk about. It's really fun.
Well, okay, so yes, I would like to hear a little personal experience, and I was going to ask Bree also the same question. Like, would you mind sharing a little bit about the subjective quality, and maybe also speaking from your own personal experientials with ketamine? Like, what has it meant for you in that subjective space?
Yeah, definitely agree with what everyone has said so far, and I think it depends who I'm talking to. So if people have had other psychedelic experiences, I'm going to describe it very differently than if somebody is coming in having no psychedelic experience. And we might get into that a little bit more, but I will often describe it as sort of just taking time out of ordinary mind. Ketamine is one of my favorite medicines to work with in a therapeutic setting because it's relatively gentle, and for the most part, and I think it's sort of the best one to introduce people to the psychedelic experience who might be looking for their own experience or wanting to explore deeper, but maybe not necessarily ready to try something like psilocybin or LSD, for example. And so I will work with clients of like just taking time out of ordinary mind. I use a metaphor of a lot of like being above the trees, of like what is the situation that we're working with or what's going on in your life, and just sort of bird's eye view of that, just getting a bit of a different perspective. And I think the other thing that I'll mention too is when I'm talking with clients as well, I spend a bit of time describing what they might be feeling or sensing, especially if they're not familiar with the psychedelic space. Just kind of describing it often as like maybe in the same way where you might experience having a dream, right? You sort of maybe have images or certain flashes of certain things, and maybe not. Every experience is different. But giving people a sense of grounding of like what is that? What does it mean to have a psychedelic experience? What does it mean to go inside? And my own subjective experience of it, I've had a few like pretty big transformative experiences with ketamine. I've had a handful. My like life-changing was at our ketamine training. Phil Wolfson, I was saying the other day I should write him an email about this. I don't think he knows. But I had a really powerful experience that really shifted my perspective of death and the afterlife. And prior to this experience, I would have absolutely identified like atheist, agnostic, and it just radically shattered everything that I had thought about what it meant to die. I could go into that a lot, but I won't. But when I was a teenager, my Nana had passed away, and I just really was like angry, and I held on to that for years. And it wasn't until having a high dose ketamine experience in a container held at a training, which was like a huge part of it, I think, had this experience of just recognizing that there was like so much more. I was like, there's so much more. And it really kind of like rocked me in a way that it took a little while to put my pieces back together. But in that way, it just shifted the way that I see the world, the way that I saw like community. It really took me out of this like individual, kind of capitalist society mindset that we live in, and into a space of being more in community, being connected with spirit, etc. And I won't go into the details because I won't stop talking. So I'll stop there.
I have two quotes from patients. I have so many memorable ones. This one, 17-year-old, 6'2", 240 pounds, treatment-resistant depression, suicidality. When we're talking about ketamine and the back and forth, and he knew a lot. He did the research, and so I took him on, and he's like, I'm healing through tripping balls. So that's one quote. Another one is an 82-year-old, depressed, also chronic pain, suffering, and very low dose, gentle brain massage, as she called it. And for the first time, she felt no pain in like decades from back surgeries, etc. And in that moment, just something happened. lifted her depression, and it was beautiful. And everyone was in tears in the room. I was in tears in the room. So then you hear about the reset button. It's like a reset, you know. It's like so much happens, and it builds, it builds, it builds. And when I come in for my ketamine treatment, it's like everything resets, and I, you know, I'm not as triggered. So that's another common experience.
Yeah, while we're on it, thank you for that. Shoshana or Sara, do you have any other, like, you know, sort of the more positive, profound sorts of experiences that you've witnessed with clients and change, or just profound breakthroughs that you might want to come up with or be able to share at the top of your head, is what I mean?
Sure. And I was thinking about something along those lines recently, and finding that unlike psilocybin or MDMA, with ketamine, I don't know if I feel like there's as much, like, you know, that powerful breakthrough and the ha-ha moment, I'm going to change my life forever. There's something about ketamine where it almost feels like there is something powerful and life-changing, but it's much more subtle. It almost feels like sitting in a room with a Buddhist monk as they're going through like a year of training, and there's just wise words coming out and depth coming out, but not as much of that powerful excitement. You know, and I think about this one client, one of my first, and her first session. And she came into the room, you know, we've been meeting a few times, and she had lots of anxiety and little blips of anger on her radar. And when she goes into the ketamine session, that came in and presented itself in the form of this intense boulder just bowing her back. She described this feeling of being weighed down by it. And, you know, you know as a therapist that what they're describing when they get into these spaces, what we're all experiencing, is a recognition of something that's with you every day, all day, just in the background. So she had been suffering from this weight for years. And she goes into this space, and she's like, what am I supposed to be doing with this thing? It's just, I can't even move, I can't do anything. And I, use the, traditional CAT therapist, like, well, let's try to move towards it. Let's try to understand it. And she's like, no. That seems like an awful idea. And she decided on a different method, a bit more Wile E. Coyote. She took the boulder and dumped it off a cliff. And, kind of similar to that space on TV, Wile E. Coyote method doesn't usually work. Back came the boulder onto her back, she's sitting there with it. She had a lot of patience, I'll give her that. She tried this several more times. Kept falling, again, I keep having Wile E. Coyote in my mind. He just never gives up, But at some point, still with actually a good amount of energy and curiosity, she turns to me, she's like, okay, well, what was your suggestion there? She's open to trying something. So I was like, well, let's just move this boulder and take a look at it. Let's see what we have here. She describes herself, because it's all in my head. She's saying it, moving towards it. And she goes, oh. And she started to describe this blue and green lichen over this boulder and this lattice work. And she described it, I could see how beautiful this really was. And then another, she said the boulder, in that moment that she could see the beauty and appreciation for it, it became a pebble. And it became this piece that she now, it's like blue and green marble that she loved. And she put it in her pocket because now she didn't want it to go away. She wanted it right there. And given that it didn't seem to be willing to go away, I felt like that was probably the better, and so it's, that doesn't change her life in that moment, but it was a change of perspective. And it's been so useful. I've seen her make leaps and bounds of growth as she moves into spaces now with that willingness to understand and explore, that ability to be open to just trying to look and see what all of this is.
wanted to add a couple things. One is that after I got laid off from the venture capitalist place, I took a break from ketamine, and then they closed, the pandemic started, and all these people started coming to see me because they didn't have any place to get their ketamine. After that break, there were some patients I hadn't seen for about a year, and they were different people, and that is what really stuck with me. And one of them said to me, look, I have freed up so much real estate in my brain now that I'm not constantly thinking of suicide. I love that. There's free real estate out there. So, you know, he's going back to school, and he moved out of his parents' house, and, you know, and people, this is a tough one for me. Some people have been chronically suicidal their whole lives, and when you go maybe to start an IV, you'll see that. They have made several attempts, but anyway, there's this, speaking of freeing up real estate, eliminating suicidal thinking is so liberating for people. But it troubles me that sometimes when some people stop taking their little ketamine at home, those thoughts come back, and that's, more data is needed. I'll just put it that way. And then when it comes to, I've been thinking a lot about this, like when people ask all the time, have you ever taken ketamine? And I just realized last week that maybe that's an important question. Like, what does that mean to that person? It could mean that I'm a druggie. It could mean that I have severe PTSD. It could mean that I'm subversive. It could mean that if I tell them about my experience, it's going to create a little path in their brain of expectation. And I don't want to create any expectations. Like you know, the ketamine failure, I always tell people, you can't do ketamine wrong. You know, let this medicine do its thing, and just stick around and let's see what happens. You know, because a lot of people, one guy came in, he had a list, you know, like, forgive dad, resolve career issues, you know, that kind of stuff. Like, and he just had this, his therapist actually said, when you go in for your ketamine, take your list of goals and look at it during the session. And so we did some work around that, but, you know, I just think maybe I'm going to hold back more about this ketamine question when people ask me, and I'm going to ask them why they're asking and what their concerns are, and what's going on with that. And, you know, nobody's ever asked me if I took Haldol or Prozac, and I realize they're different agents, and they don't ask me about other, like, how relevant is my ketamine experience to theirs? And I have said that before. I have said, look, your experience will be totally different from mine, but I want you to know that you're safe and we'll take care of you if anything happens. Like, what is just try to explore why they're asking, because some people want to have like a little drug talk, and what's that? Like, this is, I'm kind of tired of the, like, we gotta watch that, you know, drugs, you know, like, I don't like doing that with patients. Like, that's what they want to kind of have a little powwow or whatever, a meeting about their psychedelic experiences. And I don't know, I'm thinking about it. I am not a psychoanalyst, but there are things going on. I want to understand them more. Thank you.
Thank you for bringing that up, because I actually wanted to ask a question related to that, because, you know, there is more of an expectation in the psychedelic space that if you have a guide, that they have navigated the space that you're about to enter into, whether it's MDMA or psilocybin or ayahuasca, like that they've navigated that space. And that seems to be kind of an important tenet for psychedelic community practitioners. And so I'm kind of curious to ask about your opinion on like how essential was your own firsthand experiential with ketamine, like how essential is that firsthand knowledge to your ability to be an effective CAP practitioner? Is it essential? Is it not essential? Do you have any remarks on that?
I'll go. Yeah, it's an interesting space, right? Like you said, they don't ask about Haldol. And at the same time, I wonder about why that question comes up here. Maybe it's because we're all aware that there are these experiences as human beings that pretty much the majority of us will have had. You know, there's that idea that you can see the entire world in a grain of salt. We can really see everything from a single moment. And then there are unique experiences that are very rare, and that maybe a person can go their entire life without having. Sometimes it feels like people are asking because they're aware that this is not something that they can know that their therapist can understand, or their psychiatrist has a real clarity on. And when it comes to that, I've started to wonder about referring clients to people, CAP clients, ketamine clients, to people who haven't, done this. I know a lot of them from my training, but it feels like I might be setting them up. Because I've done that before, and oftentimes they'll tell me later that, they just didn't get as much out of it. When we're talking about it, it's like the therapist kind of jumped over it. Kind of like you would when you take, if the therapist heard you're taking Halidol, it's like, oh, you took Halidol, okay, now what else happened in your life? Instead of, what was that experience for you? What was the depth of it? Where did you go? You hope that all therapists, and I have met a few that can truly understand how to sit back and really hear a client's story and understand that the client's going to tell you where the depth is. And your job is to just follow them in there, not tell them where it's supposed to be. But that sometimes is rare. So sometimes this can help if we have our own experiences, to be able to say, oh, okay, I know from my own personal experience that there can be really big depth in this. Let's discuss it, let's explore.
Another self-disclosure, I played soccer a lot in my life, competitive level, from Argentina, go Messi. So just like a coach would need to have some experience with the game to have some credibility and know what they're talking about with their team, I think it's almost essential that you have your own experience. But that's my bias, I recognize that. You don't have to. Surgeon doesn't need to have their own surgery to know like how to perform a surgery, what that is like. But if they do, then they maybe have a slightly more greater understanding of how to relate to a patient that needs the surgery they had, and their skill, okay, is not going to be questioned. But just sharing in that experience and that relationship can go a long way towards healing and then recovery and the pre-op period. So with psychiatry, mental health is the same for me. It's just sharing. So I have a skill set that knows about the medication and the nerdy science and the data, and that's fine, and I can share that. But I'd love to share more about my experience because I feel strongly about it, and then I would know how to navigate spaces with them, and not in telling them how to do it, but understanding when something's coming up, like what is coming up, and so knowing that from experience, and I just think it helps me and it helps them. I don't wonder so much why they're asking the question and what that may be. Maybe I should. I haven't taken all the medications I prescribe. I've taken some out of curiosity, and they're really powerful medicines. And so, like it's no joke. And so I wanted to know what that felt like. So you don't have to. It's just curiosity. It's a way of being in the world. Again, like I would not be coached by someone who didn't play the game. And why? It's just like a deep felt. Can't explain all of it, but I would know if they didn't, and that would maybe not make me try my best or be on that team. So that's just bringing the personal into it.
I've got just two more questions, and we're going to open it up to the audience, and I think this one will be a quick question. So some people say that ketamine, so our practice, we do some CAP stuff in Fort Collins, and we get a lot of calls for people who are really wanting MDMA and psilocybin, but since those aren't available yet, I guess I'll do ketamine therapy. And so some think or argue that ketamine is sort of like a placeholder, psychedelic, sort of mimicking a psychedelic experience while we wait for like these other substances to become available. And so I'm kind of curious if you have any opinion on that. Do you feel like ketamine is sort of a placeholder therapy, or do you feel like it has its own rightful place in a psychedelic toolkit? I'm looking at you for some reason. I have the microphone. mentioned this briefly earlier, but I have a very strong opinion that I do think ketamine is a wonderful psychedelic assisted therapy, like entry level. I'll talk about this as like if there's any skiers or snowboarders in here, like green runs, right? Of like really like a good entry level point. Again, this is like my perspective. You know, you have like Rick Doblin.
Gateway psychedelic?
That's come up. This is the gateway psychedelic. Where's Sandra's in the too, right? Yeah. This is the thing that's come up. Yeah, I mean, I think it's because we can hold this space, because it's relatively gentle and and safe, and short acting, that it's a really good entry point. You know, Rick will talk about having psychedelic clinics and like legal licensed access to psychedelic clinics, like 2035 or something like that. But Rick Doblin, sorry, yeah, my friend Rick. Rick Doblin. And I think it's a really great starting point. And again, I hold the perspective that for me, I really enjoy working with clients, and a lot of my practice is actually talking about CAP4 people who are looking for more like psycho-spiritual exploration, but as an entry point of like, an entry point into deeper psychedelic medicines before exploring like psilocybin or LSD.
So you imagine that you'll still continue using ketamine even when you're
Yes.
an MDMA therapist,
Yes.
and you would still.
Yep. Mm-hmm. Yeah.
It'll be brief. I'll try not to.
Please don't dog my therapeutic substance. Thank you. I mean, I have met people, there's this presumption that if somebody does well on ketamine, well then they should go take MDMA or psilocybin. Now, I have had people who've done that, and I had worked with this man, gentle man, who had a powerful several very transformative experiences with ketamine. He had also had a transformative experience without any sort of drugs years ago, where he just, like the light in the universe just pinged right on the light in him, and it was without any sort of drugs. But he did go on to take 5-MeO DMT, nothing, DMT, nothing, MDMA, nothing. He did a guided psilocybin thing, and it was okay. I think that this gentleman responds best to ketamine. And we can't, maybe it's going to be like, some people need penicillin for this, and other. So I have noted that we all tend to kind of look down or askance at other people's therapeutic substances. And I'm not saying I'm like ketamine, true blue. I mean, I think all of these substances have utility, but it may be this assumption that like, hey, you like ketamine? Try this. I'm not sure. We'll see. More data is needed.
I think it's yes, both and. So it depends on how you're using the tool and what you want. So intentionality and what the person needs. So it's kind of like a divisive question that doesn't need to be there. And it depends on how you engage as a practitioner. So I have the ability to do all of them, like IV, IM, sublingual, sub-Q. Haven't done sub-Q yet, but I guess we know it works. We know it's a rapid antidepressant. It works fast. It's safe. It can get people out of trouble. It can prevent death. It can, independent of depression effects, it can arrest like suicidal ideation and like negative loop structure, and so that it's amazing. And do you have to provide therapy at that point? Probably no. If you want to, you can. But if the goal is get this person out of the hole and in a better space so that you can scaffold more treatment and resources around them, that's the goal, that you use it. And so it's not using it as a psychedelic, probably not. It can have that effect. So then you can use it in your clinics now because it's legal, and you can use high doses and engage in the psychedelic assisted psychotherapy and the psychedelic paradigm. So I don't think it needs to be either or, it can be both. Yes, most people that have started clinics in ketamine and ketamine assisted psychotherapy a big goal of ours is to open this up to other psychedelics. So it is holding that place and that structure and that infrastructure, and it lends itself well to that within this paradigm of medical process that we have, which, you know, we can engage in, like, how can we change it? Psychedelics can do that. The model will not work when you have longer acting 6-8 hour like journeys. How do you fit that into your clinical day? And there's all this creativity and like energy around it on how to deliver. So, but with ketamine it can be both, and it is both, and it's variable depending on dose and like, if I don't want you to die tomorrow, then come to my clinic and get ketamine to do that, and that's great. And if we engage in the deeper, longer process, that's good too. Everyone needs something at a different time in their life, and ketamine can do that. And also set and setting, and the way people come into treatment has a drastic effect on how they experience ketamine too. Well, I'll stop there.
Thank you. I just want to, I just want to ask one last question, and we'd be remiss if we didn't ask this question. And Shoshana, you feel free to contribute more, whatever you want to say here. But I just want to make sure we touch on like misuse and harms. And one, you know, there's a couple levels to this, I think. So one, like recreationally, ketamine certainly can be addictive. I mean, I know people who have had problems with addiction with ketamine, so that's real. And so there's this like draw, I don't know what we might want to speak to here, so there's this draw toward misuse of ketamine, or just like sort of addictive potential there, but then there's also opinions on the misuse of it in therapeutic spaces. So there's some people who might be critical of like IV ketamine clinics that don't offer psychotherapy and integration support. And so I'm just wondering if anybody has, and there's certainly challenging moments just in a regular CAP, you know, they're not all profound and wonderful and beautiful, and you know, there's all kinds of scenarios that could happen in that clinical encounter just on its own right. So I'm just kind of curious, is there any area of this, like ideas of just like the misuse of ketamine and these like risks of ketamine that anybody might want to speak to?
Sure, I'm happy to. You know, I'll start by just saying that I really appreciate this question. One of the things that does concern me in general and, you know, in this world is when I see things getting very evangelical. This is the best, this is what we gotta use for everyone. And sometimes you do see this in this space, and you know, it's important to always keep in mind that there are multiple pieces to everything. Sometimes there are just going to be spaces where it's not a good idea to use, you know, aspirin, you know, let alone, you know, something that is mind changing. So the idea of understanding, you know, the shadow side of ketamine feels very important of all the psychedelics. And ketamine in particular is I consider it kind of a malleable psychedelic. Some of them will, you know, psilocybin's a bit of a push into that space. Ketamine is almost that little baby psychedelic of like, oh, you know, come in, let's play, whatever feels right. And that can be wonderful in the therapy. And it can also have this darker side when it's being used you know, by someone who might not know how to heal themselves, or, you know, maybe they're going out and they're just trying to get away from their minds, which is pretty common in our culture. It seems like it's something that we're all very, you know, told to do a lot. So this is a standard response, you know, people going out and using it in more of a playful way, but then feeling, you know, finding themselves addicted to this because it is malleable. If they're trying to avoid things, ketamine will take you there. You know, that's a difficult thing, you know, and I think that this is true in our psychiatric world as well. You know, it's not, you know, it's not that this is happening everywhere, but there are spaces where people are trying to use this as the kind of traditional psychotropic, which is again that, you know, trying to get ourselves away from our feelings, suppress the feelings. Whereas with the CAP therapy, what we're trying to do is open that space up. The reason why it's shown, at least in my opinion, the reason why it's showing so much progress is because we're actually going into a space that we've been suppressing and saying, no, you know, it's like that boulder, let's move towards it, let's understand this. And when you're telling people to use to use ketamine in that suppression way, and you're a therapist or a doctor, people don't know any different. And that can have a lot of problems to their long-term ability to grow. I've talked to a few ketamine infusion clinics and their practitioners, just trying to understand what's going on in those spaces. And a few times I've started to hear that they're finding that, yeah, it's great for that first year or so, which is longer than some psychoactive medications. They're finding, okay, these people are feeling better. But I've heard from multiple people that they're finding there's a cap at that. The number I hear is 2 years. That people will go in, the suppression will work for 2 years, and then where are they? They're back where they were, and I want to know, maybe worse off, because they just took a medicine that may be useful in this new way, and they gave their mind a certain way to deal with it. Now, if they decide to try to go the CAP route and actually get some insight, I'm not sure that's available. It's very hard to tell the mind to use this substance in a new way when you've really figured out how the mind can use it to suppress it. So that's a concern.
Logoria here. I know, it's just that, my concerns about misuse of ketamine would be unethical actions on the part of the therapist. Like one therapist had this patient come to town, he was so ill, and they were gonna do this ketamine-assisted psychotherapy bonanza. Patient shows up, we do the first session, and therapist goes out of town. So I've got this very ill gentleman, traipsing around Denver. He's suicidal, he's lonely, he is in pain, and that was really hard. So I think that, and also just a couple days ago, I was talking to this clinician, and this patient is really manic, pressured speech, why won't you give me my Adderall? I need my Adderall. No, but this patient is in ketamine-assisted psychotherapy, and I'm not giving her Adderall. But just want y'all to know. Anyway, I think she needs some lithium or something, but when I called her team, the other people on our team, some of them were like, maybe some lithium for a little bit, but I think if she has bipolar disorder, I just sometimes get the feeling from some ketamine-assisted psychotherapists that they don't see a place for maybe an ongoing something like lithium for someone who has bipolar disorder. I don't know if ketamine can cure that, And so I see a sort of a dismissal of certain symptoms that are kind of concerning from my perspective, and just sort of a minimizing of certain things. And I don't know what's going on with this patient. Thank you.
Okay. Yes. I think just the one piece that I'll add, we hear so much about infusion clinics, and those of you who know me, I talk a lot about this, but I don't think infusion clinic, ketamine infusions are necessarily bad. Like Herman, we've seen so much benefit for clients with suicidal ideation, but my concern, my fear with the influx of ketamine infusion clinics popping up is that they're not offering, or not all of them, often they're not being offered with any type of preparation, education, integration. So even if somebody is seeking out ketamine with an infusion clinic, that's not necessarily a bad, from my perspective, that's not necessarily a bad thing. What I am really concerned about is, as there's more media attention around psychedelic medicine, more media attention around ketamine for depression, more and more people are seeking these types of treatment out, but not necessarily understanding that there can be a whole process around it, and not maybe being prepared for what the experience is like or how to integrate what comes up. And that's my biggest fear about infusion clinics.
Yeah, I think we do that well at Wholeness, even if people are coming for infusions. And I'm not an infusionist. I'm learning this modality, as I moved to Colorado. I worked with IM and sublingual the whole time I've been working with ketamine. It's just another tool, right? And so I want to be of service if that's what's needed. But I don't take the patient, or we don't take the patient to the furthest removed room from the clinic that's least decorated, and leave them there with the IV, right? And just babysit by a monitor. It's like it's curated in a better way. It's introduced in a better way. There's the preparation. There's the okay. We know the methodology. These are the risks, the benefits. Why are we doing IV instead of the other? It's discussed, and then yeah, there's prep. I'm in the room during the infusion, and so I like doing that, and so it's part of my process, and so if there's a need to talk or if something happened, like I'm there. That's how I want to be in that process, and so I think there is attention to be paid to that. The more and more this blows up, and a better way, better delivery when you're giving such a powerful, mind-bending, altering medication. So misuse of power, I see it too in like know yourself. Like analysts go through analysis and like they know their trigger points, and then if it gets hairy, they can refer. I'm going to refer you out. This is not good in my ability to help you. So you know your dark, your weak points, your shadow, humanity's shadow, and other therapists too. You go through like rigorous training and have your own experience to learn the method, but also experience it and heal yourself in the process so that you're a better agent of change for that person that comes. So it's in that misuse of I guess your role as a practitioner, as a provider, as a sitter, as a guide. Like you got to know yourself, and that's where people get into trouble. People are human; they haven't always done the work, and so they get captivated, hypnotized by a certain power that this brings in a very vulnerable and open heart that's undergoing this process. So it is delicate, and I think we might see it more and more, and we need to pay attention to this. Yeah.
Thank you all so much. And thanks everybody for your attention, and I think we might have time for just one or two questions. Okay, there's probably more questions than that, but one or two, and then we can also just sort of mingle and talk to the panelists. How should we, please?
So thank you so much for one. I am really curious to hear from Sara and Herman. Did I say it right? I've read a lot about, and I've seen this with clients of mine, I'm a psychotherapist, the difference in practitioners or providers who are saying yes, do the troches or the lozenges in between sessions. And then there's other practitioners or providers who are adamantly against that. And I've read, at least the things I've read, have said that's really essential to have kind of a regular in-between sessions, having the client or the patient be taking the troches.
So you're talking about at-home use?
Yeah.
So having, so in between sessions with the therapist, having the troches that you consume at home on your own. And some people saying that that's actually essential, and maybe some others questioning that practice. Okay.
This is really kind of controversial right now in my office, because it does seem to help some people, but for other people it is a cosmic Xanax. It's so wonderful. Yeah. Cosmic Xanax. I mean, I don't know. I just saw someone, I hadn't seen him for 6 months. He's been doing great, and he's been taking 200 milligrams of ketamine twice a week. He has a whole team here, the psychiatrist, but I didn't see him for 6 months, you know. And he's one of those maintenance infusion type guys, who's also so much better. Okay, well,
Troche, RDTs. Yeah, I think it just depends on your intention. Again, if you're treating mood and maintaining mood state, and so it becomes more like the medical treatment, like you're prescribing a medication to take under certain parameters that I feel comfortable with, having known and established relationship with the person, and being okay with that. And so some people need it, some people ask about it, and so we just take it step by step. Not everyone will need that. They might come for a very discrete amount of sessions, low dose, high dose, we do work, and that's it. We don't really go beyond that. But I see it more with very, like comorbidities. A lot of people are dealing with a lot, trauma, substance use, recurrent mood disorders. And so it gets a little bit more complex. And then again, in your intentionality, like how are we using ketamine for what purpose? And then like these are the conditions under which like I feel comfortable with you and I tell you why. Like so I feel comfortable with that, and I do it quite a bit, and I did it during the pandemic as we transitioned like all telehealth, and so developed the telecap, and it just took more time to build relationship and the technicalities of like how are you going to be positioned, and you have music, and so you know it's a whole process, but it was with lozenges prescribed to the home under an established relationship, and then with support on video, and so that's a model that's like a lot of people are doing now. Well, I don't know a lot, but I just met John back there, and like I'm interested in continuing this conversation because it's something that I feel comfortable doing and I have been doing. So yeah, I just think it's but that gets more into the medical side of things. Like I'm giving a prescription for you, and then it's this model of you taking a medication, but how are you engaging with it? And then we talk about that. Yeah.
Did you have a question?
Yeah, thank you. This might be kind of a complicated and specific question, but I'll just try to keep it super simple so I don't just rant.
Okay.
I work at a methadone clinic right now, so my ears peaked when you both highlighted community mental health, and I just thought of the psychedelics reaching a point of medicalized approval or decrim, whatever the hell that's going to look like. Ketamine seems to be the one with the best track record for both cost and safety in terms of accessibility in a community mental health setting. Respond. How could psychedelic-assisted therapy work in a community mental health setting?
How can psychedelic-assisted therapy and ketamine specifically work in a community mental health setting?
I know that's like, how could that work in sports? Like it's incredibly variable, but basically based on your experiences, how could you imagine?
Yeah, I also worked in community mental health, and I love the fact that it works with so many people who this work really needs to get to. Yeah, I mean, we can send psychedelics to the higher classes of all of us, but is that really going to change our world? We needed to be able to get to the people in the community mental health area. And actually, I take Medicaid for that reason. I feel like it could be used fairly easily. The problem is that there's people are rather hesitant around this. So when you consider using it in a community mental health center, what we're really talking about is how do we get people to feel comfortable enough to create a space for this. Community mental health uses all sorts of different kinds of therapy. They've made space for group therapy, EMDR. There's child's therapy. It's all over the board. But how do we get this to be in a space where people feel comfortable enough to actually be open to it? It seems a little bit harder.
Was an issue when I brought it up.
There's systemic issues, certainly with insurance reimbursement stuff, and then also the sort of just the paradigm shift of like healing work. I mean, healing isn't something we really talk about in community mental health. It's management, and so there's a bit of a paradigm shift to like get people up to speed to like, no, we're doing something different now. I think. Anybody else?
I was also just going to add that we're starting to look at doing CAP groups just for accessibility. So that is something that a number of us are working on, actively working on projects, but keep costs low, build community. Yeah.
Really quick, stop me if I'm talking too much. So the last straw for me was going to my mental health director in community mental health and saying, hey, I'm totally like digging ketamine, and I started this clinic, private practice. It's safe, there's research, we can do more. Let's do it, and it was totally shut down, and that was like, okay, see ya. But it can be done, it can be effective. there's a lot of different groups to satisfy, safety, the funding is not there, and then like the providers and education and like the getting their buy-in, and but it is where it sort of belongs to healing community and healing process, and then it's another tool. And why is it being denied to people that need it when it's not experiment? Well, it is experimental, but ketamine is here, and so we could use it, and put up the REMS, put up whatever like regulatory process you want and you need, and we can do it. I think it's just like they need to get on the wave and surf with us. Yeah.
Well, I'm just watching the time, and I'm so sorry because I think that we want to. Oh, Rob. Okay, Rob, please ask your question.
Herman, you said something about right now in the paradigm shift, ketamine being a placeholder for hopefully moving on to other psychedelics. I just wanted to ask your thoughts on how you feel the field of psychiatry and prescribers is doing with this psychedelic as a gatekeeper, and if that gives us any idea of what it'll be like in the future with like MDMA or psilocybin. But how do you feel the field is doing right now of gatekeeping the altered state?
So gatekeeping the altered state, or gatekeeping the tools to altered states, ketamine, MDMA, all of these things that are going to be available by prescription down the pipeline, and the medical profession being the gatekeeper. And there's certainly, there are already gatekeepers for psychotropic drugs, and so we could talk about historically how well that's some of the problems and limitations in that gatekeeping function. So the question is, how do you think the profession is doing currently gatekeeping ketamine, and then thinking forward to these other medicines? Any opinions on the gatekeeping function as a professional group?
Gatekeeping function for psychiatry, like medicine as a whole, like has gatekeeping on all sorts of things, and so everyone tries to take ownership of ketamine, infusion, anesthesia. You can come at it from different ways. In psychiatry, maybe we're doing a bit better, especially if you also are in the relational model and not so much in the biological, although there's a huge interest in that, and then divorcing the psychedelic effect from the antidepressant effect, and why would you want to do that and create another thing? So maybe it's the circles I'm in, but I talk to a lot of psychiatrists and doctors that are fully on board. I think where we need to step up is like education, and like again the destigmatizing and healing. Like how do people heal in that social way? Like it's psychiatry, biological, neuroscience, nerdy stuff, but there's the real ecosystem we're in, and so understanding that the paradigm doesn't fit the wisdom, intuition, traditions, and rejects that's not empirical and valid. It's a tough fight, but it's like I think there's progress. I mean, there's tremendous. There's a lot of interest right now. It's just I think it's going to take time. I think it's as a psychiatrist, I think more people are open in my field to the mind-altering effects, and so they're not as maybe maybe I am. So just convincing more people, and then yes, we need the researchers, we need the brains, we need everything, and then make it more precise. But in the meantime, is what we got. That's what we got.
Well, thank you for that. I know there's more questions. I'm really sorry. We're gonna have to we're gonna wrap up, but I think the panelists will be here for a few more minutes if you wanted to come up and say something or ask something. So thank you all so much for being here. This was just a really illuminating, interesting conversation. I hope you have a question.
Yeah, I just think it's really useful, honestly. So I came here because I thought, the idea of psychedelics in medicine almost represent a different shift from the general concept of psychiatry of giving, for example, a prescription of an antidepressant to take every day to just suppress emotions long term. And it kind of seems like I'm seeing that in the discussion in the panels themselves. in the sense that, I wonder if some of you take issue with the characterization of, okay, in between, I thought it was a great question, by the way, that was the question I was going for. In between sessions, giving additional medication for patients to take at home, that's medical, but not doing that, you said that was more medical. Why is it not medical to do it more intermittently, but then assist with therapy and try to make sure that these things don't become a substance dependence and rather focus on the psychoactive aspect of it, which tries to guide instead of suppress, like they said. So I wanted to know what your guys' perspective on that was.
I mean, so it's coming to this question of that suppressive model of just like managing symptoms versus this more evocative model of like evoking in the psychedelic or psychedelic session and with the expectation of breakthrough or change or healing, and this kind of like that paradigm shift that's happening that psychedelics represent, and some of these practices around ketamine, like where exactly does it fit? Because it seems like it's a little bit here when you're doing like that, like the psychedelic ketamine work in session, but then you're also just like taking them home for intermittent like maintenance. Is that kind of what you're saying? Just sort of like where?
Yeah, I thought it was really interesting that was it Shannon?
I'm Shannon.
Shoshana mentioned that it's kind of a hybrid drug, that it can go either way.
It's malleable,
I think if we're looking at real mental health, what is real mental health? Is it, taking something every day and getting a new dependence on a new substance? Or is it over time working and figuring out where you can build on your life, having these guideposts that maybe psychedelics can represent, and shifting our idea of medicine towards that so that we can find a real foundational, permanent mental health that doesn't depend on long-term substance use.
Can I name something? That there are times when that is at the time when using it intermittently can be super helpful. So I have a chronic pain condition, and when it flares up and I'm 15 hours into a level 8 pain, that the emotional piece that comes out of being in pain, having something that could get me out of pain and give me that moment of not only the relief from the pain, I then have more mental resources to be able to deal with what comes after. Because with ketamine, it might drop my pain during the moment, but as soon as it's gone, I'm still in the pain. But it might not be an 8, it might be a 7, it might be a 6, right? But I will then have more capacity and more emotional resources to be able to address that level of pain. So I think that there are times when it is the compassionate response to be able to have someone have it on their own.
I hear that, and I want to acknowledge that I have a client right now that uses it in both ways. And maybe that's where my mind goes with this, is that we're talking about all these different models, all these different ways of doing things. But in the end, my sense is that the important part is that in the end, are we going inwards or are we going outwards? If we're using ketamine multifacetedly to get ourselves out of a very difficult moment and then walking away and, kind of expecting it to be this thing that catches us, anytime we need it, and then walking away and going outward, that's something that we've been trying as a culture for many, many years, and it seems like we're running into the walls of that. It just doesn't work to go outwards forever and ever. At the same time, if we are finding a way to use ketamine in a variety of ways, just once a month to go inward, or sometimes to go inward and sometimes to get ourselves out of these very difficult and painful spots, and then to go inward. Like, as long as we are finding ways to explore ourselves, to make sure this is a healing method, to make sure we have therapists around us, or friends, or anything that's really supporting us and getting us to develop ourselves to grow. I see this as being very versatile. It can be used in a lot of ways. We just have to remember what our end goal is and make sure we're always pointing towards that.
Thank you for the question. I think it's an important question, and it sort of gets to the crux of what so much of this is about right now. And so thank you to our panel for sharing your time and Thank you to everyone for being here, for engaging, for listening, for participating. We'll be back here December 2nd for another meetup, and our good friend over here, Mr. Riley Capps, will be giving a lively talk on the future of psychedelics. Apparently he's a fortune teller also, and he's going to tell us a little bit about the future. So we look forward to that. Thanks everyone for being here. Please stick around, say hello to someone you haven't met, say hello to us, and we look forward to seeing you next month. All right, bye.